In the battle against persistent asthma, two inhalers take center stage: Symbicort and Dulera. Both are prescribed to provide relief and control symptoms, but which one should you choose? In this video, we will explore the key differences between Symbicort and Dulera, helping you make an informed decision about which inhaler is right for you. Symbicort and Dulera belong to a class of medications called combination inhalers, which contain both a long-acting bronchodilator and an inhaled steroid. These medications work together to open the airways and reduce inflammation, providing effective symptom control for individuals with persistent asthma. While both inhalers offer similar benefits, there are some notable distinctions. Symbicort contains budesonide and formoterol, while Dulera contains mometasone and formoterol. These differences in active ingredients may influence how each inhaler works for different individuals. Furthermore, Symbicort and Dulera may have varying side effects and interactions with other medications. It is important to discuss these factors with your healthcare professional before making a decision. Join us as we examine the inhaler duel between Symbicort and Dulera, helping you navigate the complexities of asthma management and find the right solution for your needs. Understanding persistent asthma. Persistent asthma is a chronic condition characterized by recurring symptoms such as wheezing, shortness of breath, chest tightness, and coughing. It is caused by inflammation and narrowing of the airways, leading to difficulty in breathing. Managing persistent asthma requires long-term treatment to control symptoms and prevent exacerbations. One of the mainstays of treatment for persistent asthma is the use of inhalers. Inhalers deliver medication directly to the lungs, targeting the source of inflammation and providing rapid relief. Combination inhalers like Symbicort and Dulera are commonly prescribed to individuals with persistent asthma as they offer the benefits of both a bronchodilator and an inhaled steroid in a single device. By combining a long-acting bronchodilator and an inhaled steroid, combination inhalers work synergistically to open the airways and reduce inflammation. The bronchodilator helps relax the muscles surrounding the airways, allowing them to widen and improve airflow. The inhaled steroid works to reduce inflammation, preventing the airways from becoming irritated and narrowing. Key differences between Symbicort and Dulera. While Symbicort and Dulera belong to the same class of combination inhalers and work in a similar manner, there are some key differences between the two that may influence their effectiveness and suitability for different individuals. Active ingredients. Symbicort contains budesonide and formoterol as its active ingredients. Budesonide is a corticosteroid that helps reduce inflammation in the airways, while formoterol is a long-acting beta agonist that acts as a bronchodilator, opening up the airways for improved breathing. On the other hand, Dulera contains mometasone and formoterol. Mometasone is another corticosteroid, similar to budesonide, that helps reduce inflammation. Formoterol, like in Symbicort, acts as a long-acting bronchodilator. Dosing and administration. Another difference between Symbicort and Dulera lies in their dosing and administration. Symbicort is available in different strengths, allowing for customization of the dosage based on individual needs. It is typically administered as 2 puffs twice daily, with each puff containing the prescribed dose of budesonide and formoterol. Dulera, on the other hand, comes in a fixed-dose combination inhaler. It is available in different strengths, but the dosage of mometasone and formoterol remains fixed. The recommended dose is usually 2 puffs twice daily, delivering a consistent amount of medication with each use. Inhaler device. Symbicort and Dulera also differ in terms of their inhaler devices. Symbicort utilizes a turbuhaler, which requires a different technique for inhalation compared to other inhalers. It involves loading a dose by twisting the base, inhaling forcefully through the mouthpiece, and holding the breath for a few seconds before exhaling. Dulera, on the other hand, uses a pressurized metered dose inhaler, PMDI, with a built-in dose counter. This type of inhaler requires coordination between pressing down on the canister and inhaling the medication simultaneously. It is important to receive proper instruction from your healthcare professional on the correct use of the inhaler device to ensure optimal drug delivery. Effectiveness and efficacy of Symbicort. Symbicort has been extensively studied and proven to be effective in the management of persistent asthma. Clinical trials have shown that Symbicort provides significant improvements in lung function, symptom control, and quality of life for individuals with persistent asthma. A study compared the efficacy of Symbicort to other commonly used inhalers in patients with moderate to severe persistent asthma. The results showed that Symbicort provided superior asthma control, with a lower risk of exacerbations and a higher rate of lung function improvement compared to other treatments. The combination of budesonide and formoterol in Symbicort has been shown to provide rapid relief of asthma symptoms, with improvements observed within 15 minutes of inhalation. This makes it a valuable option for individuals who require quick symptom relief, especially during asthma attacks or episodes of worsened symptoms. Additionally, Symbicort has been found to reduce the need for rescue medication, such as short-acting bronchodilators, and decrease the frequency of asthma exacerbations. This contributes to better asthma control and helps prevent emergency healthcare utilization. Effectiveness and efficacy of Dulera. Similar to Symbicort, Dulera has also demonstrated its effectiveness in the management of persistent asthma. Clinical trials have shown that Dulera provides significant improvements in lung function, symptom control, and quality of life for individuals with persistent asthma. A study compared the efficacy of Dulera to other combination inhalers in patients with moderate to severe persistent asthma. The results showed that Dulera provided comparable asthma control, with similar rates of lung function improvement and symptom reduction compared to other treatments. The combination of mometasone and formoterol in Dulera has been shown to provide sustained asthma control, with improvements maintained over time. This makes it a suitable option for individuals who require long-term symptom management and prevention of exacerbations. Additionally, Dulera has been found to reduce the need for rescue medication and decrease the frequency of asthma exacerbations, similar to Symbicort. This contributes to improved asthma control and overall better management of the condition. Side effects and safety considerations of Symbicort. As with any medication, Symbicort may cause side effects in some individuals. The most common side effects reported include headache, throat irritation, hoarseness, cough, and fungal infections in the mouth and throat, thrush. These side effects are generally mild and temporary, often diminishing with continued use. In rare cases, Symbicort may cause more serious side effects, such as increased heart rate, high blood pressure, chest pain, or allergic reactions. It is important to seek medical attention if you experience any severe or concerning side effects while using Symbicort. Symbicort may also interact with certain medications, such as beta blockers and some antifungal medications. It is important to inform your healthcare professional about all the medications you are taking to ensure there are no potential interactions. Side effects and safety considerations of Dulera. Similarly, Dulera may also cause side effects in some individuals. The most common side effects reported include headache, throat irritation, hoarseness, cough, and fungal infections in the mouth and throat, thrush. These side effects are generally mild and temporary, often improving with continued use. In rare cases, Dulera may cause more serious side effects, such as increased heart rate, high blood pressure, chest pain, or allergic reactions. It is important to seek medical attention if you experience any severe or concerning side effects while using Dulera. Dulera may also interact with certain medications, such as beta blockers and some antifungal medications. It is important to inform your healthcare professional about all the medications you are taking to ensure there are no potential interactions. Choosing between Symbicort and Dulera for persistent asthma. When it comes to choosing between Symbicort and Dulera for the management of persistent asthma, several factors should be considered, including individual preferences, cost, ease of use, and potential side effects. Some individuals may prefer the dosing flexibility offered by Symbicort, as it allows for customization of the dosage based on individual needs. Others may find the fixed-dose combination inhaler of Dulera more convenient and easier to use consistently. Cost is also an important consideration. Symbicort and Dulera may have different costs depending on factors such as insurance coverage and availability of generic versions. It is advisable to check with your healthcare professional or pharmacist to determine the most cost-effective option for you. Lastly, potential side effects and individual tolerability should be taken into account. While Symbicort and Dulera have similar side effect profiles, some individuals may experience different reactions to each medication. It is important to discuss your medical history and any concerns with your healthcare professional to ensure the chosen inhaler is well suited to your needs. Cost comparison of Symbicort and Dulera. The cost of Symbicort and Dulera can vary depending on several factors, including insurance coverage and availability of generic versions. It is advisable to check with your healthcare professional or pharmacist to determine the most cost-effective option for you. In some cases, generic versions of Symbicort or Dulera may be available, offering a more affordable alternative. Generic medications contain the same active ingredients and are equivalent in terms of efficacy and safety. However, it is important to ensure that the generic version is approved by regulatory authorities and meets the required quality standards. Additionally, Some insurance plans may cover one inhaler more favorably than the other, leading to differences in out-of-pocket costs. It is recommended to review your insurance coverage and consult with your healthcare professional or pharmacist to explore cost-saving options. Conclusion: selecting the right inhaler for your persistent asthma. In the duel between Symbicort and Dulera for the management of persistent asthma, both inhalers offer effective symptom control and improved lung function. The choice between the two depends on individual preferences, cost considerations, ease of use, and potential side effects. Symbicort and Dulera have similar mechanisms of action, combining a long-acting bronchodilator and an inhaled steroid to open the airways and reduce inflammation. However, they differ in terms of their active ingredients, dosing, administration, and inhaler devices. It is important to discuss your specific needs and concerns with your healthcare professional to determine which inhaler is the most suitable option for you. They will consider factors such as your asthma severity, medical history, and lifestyle to guide you in making an informed decision. Remember, effective management of persistent asthma requires adherence to prescribed medications, regular follow-up with your healthcare professional, and a comprehensive asthma action plan. By working closely with your healthcare team, you can find the right inhaler that helps you achieve optimal asthma control and enjoy a better quality of life.